I'm Dr. Smith.
Nice to
Come and
meet
have
you.
a seat.
Thank you.
So come into the emergency department today with some kind of palpitations.
Yes, I
heartbeats.
was racing hard. I was more concerned. Yes.
Has this ever happened before to you?
Not that I could notice. No. When I was walking uphill, I just couldn't tolerate this. Yes.
And so we've been through all your history now, and we've examined you, and we've done heart tracing. And actually, we have identified an abnormality on your heart tracing, which would explain why you're having these palpitations.
Right.
In your heart tracing, it shows us that you've got so the way your heart beats from the top, and then it gets an electrical current that goes down and to the bottom and then back up. You have an additional pathway in your electrical conduction system in the heart, and this is causing your heart to get electrical signals where it wouldn't normally, and for you to go and have palpitations.
Okay.
Okay, and so we're pleased that your palpitations have now stopped, so you've gone back into your normal beating. However, now we know that your ECG suggests that pathway is there, it's important we follow that up.
Oh, do you think so? Okay.
Okay, so what we'll do is we'll refer you to cardiology to see them.
Okay.
Is this something you've ever heard of before?
No, not that. No.
Okay, so its name, if you happen to, if anyone asks you or you want to know more information, it's called Wolff-Parkinson-White. That's the name of the syndrome. It's named after someone a long time ago who identified it to start with, and that's what it's called. And it's this phenomenon where you do have this additional pathway of electrical activity.
Okay.
So we'll refer you to cardiology, and they will then see you again and assess you and go through everything. And there are procedures they can do to stop this extra pathway. Okay, so and they'll be able to discuss with you more about that at the time.
Is it important for me to go through this, or because I feel okay now?
Yeah, absolutely.
Can I just leave it?
So there is always the option. It's always your choice. However, you have palpitations now already. That pathway is there, so there is always a risk that you will have more palpitations. Sometimes these can be quite dangerous. This is why we should address it and look into it further and see what we can do about it. If in the meantime, between now and seeing the cardiologist, you have any more palpitations, more chest pain, anything like that, it's important to seek medical help.
Okay, so do you want me to come back to any of this?
Absolutely.
Okay, sounds good, yeah.
Have you got any other questions I can help you with now?
No, I think you've told me if there's any new palpitations I should come back. Yeah, that sounds reasonably a good choice, yeah.
Absolutely, yeah. I've got some information to give you as well about this. It's just so you can have a bit of reading if you want to find out some more information. There's a lot on the internet, sometimes it can be a bit overwhelming, so probably best to start with this kind of information first from a good source.
Sounds perfect, yes.
All right.
Thank you.
No problem.